Understanding the Human Development Commission's customers and the role of a community action program relates to a simple principle. In order to really be effective at changing something, you have to understand the problem. Community action programs are byproducts of social welfare policy, passed to look after the welfare of Americans. However, social welfare policy can be confusing. When talking about social welfare policy, we hear a variety of terms that, without careful examination of context, may be complicated to understand. Specifically, the term welfare, because it carries overlapping meanings. Defining welfare really depends on individual perception. To some people, welfare is associated with resources given to individuals whose basic needs are unmet, while others believe welfare is related to an individual's well-being. It's especially important to understand the context of welfare as it shapes attitudes and beliefs about social welfare policy. Consider welfare as a thing versus welfare as an idea. As an example, let's use the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. This program is a social welfare policy product that can be used as payment for individuals to buy food. But what does it really do? What is the bigger picture? We have to consider its contributions to society as a whole, that it provides a safety net for nutrition, and that it prevents hunger or food insecurity. Therefore, when welfare becomes part of social policy, it has to do with the improvement of the well-being of disadvantaged social groups. Social welfare policy shapes principles, procedures, and courses of action established in statute, administrative code, and agency regulation that affect people's social well-being. Social welfare policy is guided by the following principles. Number 1, there are limited resources. Number 2, there are unmet needs. Number 3, inequities are built in. And number 4, there is a lack of consensus. Consider it as a way of protecting society. This slide features a few solutions or products of social welfare policy. As an example, the 1935 Social Security Act signed by President Franklin D. Roosevelt, and the Medicare Bill of 1965, which includes Medicaid, signed by President Lyndon B. Johnson. What happens when there are no resources? American poverty at its worst. The Roaring Twenties was followed by the worst economic disaster in history, the Great Depression. On October 29, 1929, otherwise known as Black Tuesday, stock markets crashed, leveling the playing fields between all economic strata. The Great Depression lasted 11 years, from 1929 to 1940. President Herbert Hoover was in office and grossly underestimated the seriousness of the situation, calling it a passing incident in our national lives. He promised Americans it would be over in 60 days. Men who were rich bankers and stockbrokers found themselves literally peddling apples on the street. People lost everything, and there was no safety net to protect them. People lost their homes. They lost everything. The photos on this slide illustrates consequences of the Great Depression. Lack of resources, in this case housing resources, led to Hoovervilles, which were tent or shack towns where people took refuge from homelessness. 25% of the country was out of work, and there were no forms of federally financed safety nets or welfare programs to protect them. It took nearly 4 years and a new president to lay the groundwork for recovery. It was not until President Franklin D. Roosevelt introduced the New Deal that Americans started to feel relief from the Great Depression. To show how quickly this effort took place, major legislation passed within 5 days of its submission. President Roosevelt proved in his inaugural speech that the only thing we have to fear is fear itself.
Let me assert my firm belief that the only thing we have to fear is fear itself.
The New Deal was a package of policy that included the National Housing Act of 1934, which released private credit from banks and lending institutions for home repairs and construction, the U.S. Housing Act of 1937, which established the first public housing program for low-income families, and the Social Security Act of 1935, which was a social insurance system designed to pay retired workers aged 65 and older with continued income after retirement and help those who are unemployed or disabled. However, policy is not perfect. With the New Deal came a byproduct of the Social Security Act called the Aid to Dependent Children Program, or ADC. It actually began as ADC and was later changed to Aid to Families with Dependent Children Program, largely because of criticism towards the program's guidelines. This program was a centerpiece for stereotypical welfare, a single mother and her children. It was a highly controversial program and left a bad taste in the mouths of many. First, it was for white, poor, single mothers and did not include blacks until the 1960s civil rights movement, which expanded welfare programs to include blacks. Second, it was a program largely based on discretion. State caseworkers, supervisors, and administrators were left to decide who received aid and how much based on what they considered suitable homes. Suitable homes excluded cohabitating couples, leading to the assumption that the program discouraged marriage. And third, income limits were determined by each state, and oftentimes so low it led to the assumption that the program discouraged women from working. The 1940s brought about the GI Bill of Rights, which provided programs and services specific to returning servicemen, and the Hill-Burton Act for major construction of hospitals. The 1950s changed voting rights for blacks and helped integrate their children into public schools. The 1960s pushed even further for civil rights. This is important because it paved the way for community action programs. The Kennedy administration was very much interested in solutions for American poverty. However, due to his assassination, President Lyndon B. Johnson was charged with pushing through the 1963 Civil Rights Act. And that was a hard thing to do. The House of Representatives passed the bill after 70 days of public hearings, rejecting nearly 100 amendments to weaken it, 275 witnesses, and 5,702 pages of published testimony. To clear the Senate, it took 83 days of debate and 3,000 pages of congressional record. In fact, it launched the longest filibuster in history and nearly brought the Senate to a standstill. July 2, 1964, marked the end of business as usual. Discrimination based on race, color, religion, sex, or national origin became illegal in the United States. With that, President Lyndon B. Johnson also declared the War on Poverty, introducing and signing into law the Economic Opportunity Act of 1964. The two go hand in hand. As we learned during the Great Depression, poverty does not discriminate. The Economic Opportunity Act brought with it multiple anti-poverty programs, including Head Start, Job Corps, work-study programs for university students, AmeriCorps Vista, Neighborhood Youth Corps, basic education, and adult training. And also part of the Economic Opportunity Act are community action programs, which propose maximum feasible participation. Community action programs change the way things were done because maximum feasible participation encourages low-income people themselves to actively participate in determining programs and services that would best help them. As an example, the Aid for Families with Dependent Children program was highly criticized because of the control state governments had over its recipients. Instead of, we know what's best for you, it's, we know what's best for ourselves. That is not to say that there isn't guidance. Community action programs are required to have three-part boards consisting of local private sector, public sector, and low-income representatives. Using realistic, practical approaches, community action agencies, like the Human Development Commission, can develop programs and services that make sense for the communities in which they cover. Community action is about helping people invest in their futures by guiding them towards self-sufficiency and not dependency. The cornerstone of community action programs is to tailor programs to meet the needs of communities in which they serve. Therefore, they understand poverty and they understand it at a local level. Community action programs are one of the largest users for volunteer services in the country. In fact, in fiscal year 2015, the Human Development Commission mobilized the good works of 646 volunteers. The Aid to Families with Dependent Children program finally was reformed in 1996 by the Clinton administration. Major highlights of the reform included welfare time limits, tightening of the definition of disability to exclude alcoholism and drug addiction, and emphasized work over welfare. We have covered social welfare policy, what it is, why it's there, and its major accomplishments. Let's consider a scenario. A rundown apartment can exacerbate a child's asthma, which leads to a call for an ambulance, which generates a medical bill that cannot be paid, which ruins a credit record, which hikes the interest rate on an auto loan, which forces the purchase of an unreliable used car, which jeopardizes a parent's punctuality at work, which limits their promotions and earning capacity, which confines them to poor housing. Because community action focuses on crisis intervention and self-sufficiency, this is a great example of who our customers might be. It demonstrates how difficult it is to move someone from poverty to the middle class. This person is making it. However, if one thing falls out from under them, they're going to be in crisis mode. In the body of the house on the right are buzzwords for basic needs of a stable family: transportation, education, housing, income maintenance, health, nutrition, employment, and emergency services. The question to the left asks, what do you think is most important? If it's easier, consider the top 3 buzzwords as shown in the roof of the house. The answer is, a family needs all of the elements inside of the house to remain stable. Community action agencies like the Human Development Commission can help families and individuals reach self-sufficiency by connecting them with resources. Together, they can build the road to self-sufficiency through restoring hope by helping people and changing lives. To contact the Human Development Commission, please call 1-800-843-6394.